you want to be unmuted?
I think it looks like we've got all the rooms back. Amy, can I just check that's right?
Yes, and apologies, my system crashed, and that's what brought you all back to a speedy return here before the 4 minutes up. So apologies for that.
No worries. Thanks, Amy. Yeah, sorry about that. So if you were just about to agree who was going to feedback from each group, you may not have got to that point. So apologies if this doesn't work quite so smoothly as planned. I went into 4 of the different breakout rooms and had some really interesting conversations, all completely different. So it'll be good to hear what was covered in each one. So I think there were 6 altogether. Is that right?
Yes, 6 breakout rooms.
Okay, I'm going to go traditional order and ask for room 1, if that's all right, to just pop in and let us know how it went and any key points from your groups.
Yeah, thanks, Anna. So I'll speak on behalf of room 1, but if anybody wants to kind of pop in as well, there was a couple of hands up when we finished. So it was a really interesting discussion. I think we had lots of community-based advisors on the call who felt that, you know, overall, given the kind of the barriers and the sort of self-selection that kind of happens before people present at services, you know, they kind of have chosen those services because they have access, support, or just really strong preference for kind of in-person community-based type services, that there were probably relatively limited you know, opportunities to refer clients out to nationally accessible services. One participant said maybe around sort of 15 to 20% of clients possibly did have the sort of the capabilities to kind of engage with those services, but actually, given their strong preference for the community-based service, actually the level of effort required to kind of make that transfer, it might not necessarily be worthwhile to kind of do that. It doesn't really make a massive difference to their overall provision. That said, we kind of then discussed a few sort of different ideas, and we were just discussing towards the end there, you know, could we use place-based services with sort of additional support roles to kind of provide access both to kind of other debt services, but other support services as well? So this is a kind of, I think we've discussed as well, this sort of social navigator type model where someone is there, not necessarily as an advisor, but to provide kind of, you know, that sort of initial support to access the service, kind of collection of documentation, but also ensuring that someone is kind of staying engaged in the journey. So really leaning into that kind of, you know, building that sort of relational support around somebody, but kind of keeping the sort of the different skills that's, you know, and advice needs that someone have kind of in discrete roles. So kind of maybe it's a more sort of an access and engagement type role. So something for us to think about there, I think.
Great, thanks, Christian. I think I heard something similar, but being done in a slightly different way from one of the other rooms. So it'd be interesting to hear how that's working. I think it was Cheryl who's talking about that. Great, thank you. Can we move on to room 2?
Yeah, that was us, Anna. So again, people who are in our group, please do feel free to chip in, especially if you're one of the people mid-flow when we got brought back into the main room. So we had quite a mix of different organisations in our group, and one of the threads we looked at was just the kind of challenges of referrals to kind of standardization and data and the barriers sometimes around data sharing. And obviously referrals work much more effectively if as much information as possible can be handed over, but there's some you know, real challenges around consistency of how different agencies are working. We spoke about the challenge of referring from a national telephony provider into local services, and the, you know, just the sort of scale of the task of maintaining the database that's up to date, that really kind of understood what services were on offer and what capacity there was to accept referrals. So that's a real sort of practical barrier. We spoke as well about some of the, you know, the challenges around confirmation of advice letters and case notes, and the impact that this is having on capacity within the sector. And you know, this is real theme that keeps on cropping up and is something that you know we need to focus on. It's definitely something that's come up at the advisor panel discussions too. We spoke as well about mutual understanding between services, of knowing actually what is on offer to refer somebody into, and that maybe some of that's cultural, but actually, you know, it's just a sort of real challenge, I guess, with the day job to maintain that ongoing awareness of what is on offer from other services, and that's not just debt, that's looking at kind of wider advice. And then we also spoke a little bit about some of the challenges, particularly when dealing with, you know, kind of more vulnerable clients, when you've built up a relationship with somebody that, you know, you might reach a point. So we were talking about sort of a telephony-based service that does lots of work with very vulnerable clients. They sometimes feel that actually there would be some real benefits of working face to face with the client, because they're just not getting the information they need to help the case progress. But that because the relationship has been built up with this provider over a period of time, it's quite difficult to then make that transfer in a way that engenders trust and continues to have the level of engagement that they would like. So some quite sort of practical things for us to think about, and some, like I said, some really interesting stuff about just sort of understanding the nature of different services. Anyone else who is in the group, please do chip in if you think I missed anything.
Hello, my name's Lee. I'm working for We Are Digital. Some of you may know me because I have worked at MAPS before, a long time ago. I've just got a couple of things just to add to that, actually. One around the power of MAPS really with this commission and being able to fix the system. So where there's a lack of, because there's more demand than capacity. So being able to enable people to complete when there is spare capacity and when they are busy is super helpful, and being able to direct the funding to those organisations that are able to, as part of their remit, kind of inform and share data, I think is really important, because then the user gets a much better informed experience, and the referral person is able to transfer that person to where they do have space and they will have support, whether that be multi-channel or not. And then the next thing is around assisted digital and the role of that with this piece of work, because ideally you would want face-to-face for everybody, but it's just not practically economically possible, and it would mean that you then have to reduce the number of people you can help. So actually being able to streamline services so that where people have got information that they need to share, being able to give them proper digital support and give them the skills that they need to be able to do it, not just to help them with this one transaction, but with other transactions to do with their financial well-being, I think is crucial to it. And being able to incorporate that within the brief is super important. I come from that background anyway, as some of you know, but with this, I think it will enable the capacity to be optimized and the cost to be reduced, but also doing something really good for that person by giving them the skills that they need for this century anyway, in all sorts of ways to do with money outside of debt, but potentially getting them out of debt. Lloyds Bank Consumer Index research, for example, shows that people that are in the same job or have the same level of income, if one's got digital skills and one hasn't, their revenue is increased by £600 a year, and they can save up to £400 a year more as well, and that's for all income groups. So yeah, I think it's really powerful in this to incorporate digital inclusion, and I would be very happy to offer any advice on that, just pro bono, just because I'm passionate about MAPS and what you do, and also I want to make sure that this piece of work helps as many people as possible. So thank you.
Thanks, Lee. Great, we'll move on then to room 3.
Yeah, I think that was us. Got cut off at a really good time. We were finishing on a real positive note, and it was like, oh, and we got cut off. But so one of our participants mentioned about the Rethink referral portal and how that can work really well. And they also work for a national organisation, and they've got on their intranet, they've got a list of local services per region, which is really helpful to let them know what services are available local to that client. But there was a consensus amongst many of the group that whilst they might have really good relationships with local services, the relationships kind of feel a little bit one way, where the referrals are coming in from them, really great, but when trying to refer back out for that additional support, it's very challenging. So it can be a lot of the time there's a real onerous procedure and a criteria that the client has to meet, and often the client doesn't meet that criteria, so they can't refer back out. And there was a couple of comments about how some services feel once they've referred that client into debt advice, they're their client then. So the referral back out is just almost non-existent. So there was a lot of challenges regarding that. But we were finishing on a high note. One of the participants mentioned that she works within the local authority, and they've got a really good support network in place with a lot of external services, to the point where they meet every quarter and to discuss it. And they often make warm referrals, and it kind of works really well. Didn't quite get enough time to get a bit more detail on that, but that was a real positive from that. So I don't know if anyone from the group wants to elaborate on any of them points at all.
Thanks.
I guess I covered them really well.
You covered them really well. Thanks, Andy. And obviously, if there's anyone who was midway through anything, or if they have any other comments they'd like to make, then we'll you're obviously happy to hear those outside of the meeting as well, so we can follow up afterwards. Thanks, Andy. I think we're into room 4 now.
Which I think was Dan and Erica were in that room.
We seem to have lost Dan, so I wasn't quite prepared in terms of the feedback, and have to confess my team's dipped in and out a couple of times, so there may be things that I've missed. So please do chip in if you've said something while I've been out of the room. So we've had some conversation about initially making internal referrals between face-to-face services within a partnership, where particularly where partners are lacking capacity, so not necessarily about making referrals from one service to another in the client's best interest, but simply because the referral where the client has initially presented has had difficulty in actually being supported. So waiting times have been a difficulty because demand for the services is so high. There was definitely a piece that I missed immediately after that, but then we talked about having confidence in referrals and the importance of having confidence in the people that you're referring your client to. It takes a significant period of time and investment and resource in order to make sure that you have confidence in the referral partners that you're passing your clients on to. And I think you want to be the other point that I took away from that was that they were looking to significantly increase referral relationships with DRO hubs and wanting to be cited on waiting times before making a referral for a client. Thanks, Dan. You're back. I'm happy to continue, or for you to pick up.
I don't know where you've covered, but I think I've got a gist of it. Yeah, that was the time that my computer decided it was time to melt. So
Yeah.
right at the time that I switched the camera on. So yeah, I gather that you were just mentioning about the conversation that we're having around referrals. Well, a lot of excess demand at the moment that we're aware of on the face-to-face providers mean that they have no choice but to refer people on. So it's not necessarily because of other needs or vulnerability, but because there's just no capacity, certainly at the local level, to help people. An interesting, and again, sorry if you've mentioned this already, an interesting suggestion actually from a member of the group, and I'm not going to name and shame, was around having a dashboard, having sort of almost live information or regularly updated information about waiting times. So, you know, if you're referring out to a face-to-face provider or a DRO hub, what are the waiting times to get access to that service? What are the typical waiting times to get a DRO client seen, and so forth? So that I thought was really interesting. Other interesting points as well. There was a point made around well, resource again, especially for sort of trying to establish trying to establish relationships, especially sort of local to national, national to local, takes a lot of resource. You need dedicated individuals. It's a long process to do that. So it is a lot of work, and you need that kind of continual commitment and work at it to make sure it's done, and all the processes are implemented and kept to and established within an organisation. It can often be almost like a cultural change for an organisation to do a piece of work like that. There was a lot of emphasis on things that we're all very aware of around local providers, community-based providers have access and the ability to build up relationships with local creditors, whether they be sort of local authorities, for example, maybe water and sewage creditors and so forth. So there is definitely that was recognised. An interesting point as well that was made about business debt clients, and again, it's about establishing those relationships. We had somebody from Business Debt Line talking about, well, if I'm speaking to someone and they clearly need a local provider to help them, getting access to a face-to-face service is one challenge, and then there's the additional challenge to see if that face-to-face service is actually able to help someone who has sort of more specialist debt issues around business debt, for example. So that was another point that was raised, which is very interesting as well. So I did get what I thought was a really great question at the end, but then we got cut off short. So if anyone else has got anything else to say, that's please chip in.
Thanks, Dan and Erica, for the feedback from room 4. Room 5 then, please.
Which I think was Sam.
Very similar to some of the feedback that we've had. I think we had a lot of discussion in the group around the role of the community organisation, and that having been the client's preference, and the organisation ultimately looking at what they can do to best support that customer, working with a support network around them. And we had some experience fed back about potentially signposting out, or even potentially even making a warm transfer to, say, telephone-based services. But then what happens is that then customer might present back to that organisation in a couple of months down the line. So I think some feedback that we had from one organisation is about how they're looking at what is their role in respect to the debt advice delivery, and how they are what they can best support the customer with, and then looking at the package of support from other local services, for example, welfare support within a local authority that can help with benefit maximisation, support with grants, to then complement the delivery, complement their delivery in best supporting that customer. Because I think we also then had the feedback around, again, people presenting to the community organisations, it's maybe a broader support that they need just then beyond the debt advice. So it's dealing with digital exclusion, social support, isolation, helping them to improve their confidence. So it's about how that service is predominantly best placed to support, but that actually then the capacity and then demand on that service can obviously affect their ability to do that. So kind of building that support network around them. We had someone on the call talked about a local authority scheme in one area that's set up that multiple agencies are part of, and then can refer a customer or a client in need to then a package of support. And obviously what's covered through that is then that data sharing piece, and be able to share information with different partners, and it then prevents a client from having to repeat their story to multiple agencies, and that they can get then that package of support. And that scheme that's operating in that local authority has got statutory support and seems to be going really well from the feedback that we had. We did then have feedback from someone in the group who has had experience of working in telephone service, and again, any customers that may come through on that service but need that face-to-face advice, and how they can then best connect those clients into those services, and try to do it by making direct referrals as opposed to signposting. But then that's quite difficult when the capacity of that receiving organisation is not known. So sometimes obviously you are then signposting out. I think that's probably everything in respect of what came out of room 5 that's similar to or slightly different to what's come out of the other rooms, unless anyone else from room 5 has got any other feedback to share. Yeah, and I just see that David's posted a link in the chat to the scheme that he talked about in our breakout room. So thanks for doing that, David.
That's great. Thanks, Sam, and thanks, David, for the link there. Our final room then, room 6, please.
Yep. So again, very similar, but what really came through in this group was a couple of people that were talking. It really was quite different. So one organisation very much about working with clients and talking to like local housing providers and being involved in those conversations, being involved in sort of the benefit side of things as well if that was needed. So quite sort of, you know, working through very closely with the client and give them a lot of support there. So not necessarily referring out, but then another example was where they have good relationships with organisations and they tend to refer to those organisations that have those different specialisms, whether it might be around housing, whether it might be about benefits, etc. So quite a contrast there. One of the things that also came through was someone talked about how they volunteer for another charity and they're picking up things from local CABs because they haven't got the capacity to deal with sort of things like benefits anymore. So that's sort of putting another pressure elsewhere because there isn't the specialisms locally, and they've been picking up those as well. So yeah, that's pretty much and very similar to what other groups have mentioned as well. So yeah.
Great, thanks, Sarah. And yeah, I was in your group for a while and heard that. It was really interesting and quite different models going around the different rooms. Definitely some themes though about making it very client centric and being really clear. This comes out of the research and has come out from the groups that there are some things that absolutely have to happen before you can help a particular client in moving forward with their debt advice. So yeah, very much about that sort of client focused approach that has really come out very strongly. So we've got 5 minutes left. I thought we'd answered all the questions, but there's been another comment. I don't know, is that David? Do you want to ask that? Is that a question or a comment?
A comment rather than a question.
Okay.
And I mean, I think, yeah, you know, I think it's been a really good discussion this afternoon, but I do think there have been some assumptions baked into it that really need to be challenged and considered differently. I could say more, but we're out of time nearly, aren't we? So
Okay, well, yeah, I mean, I think certainly I've picked up a very strong that this should be, that everyone was talking about how it should be very much about what the client needs rather than the services as such. But obviously at some point you have to design the services, but at that point you hope you've taken into account the client needs. But I'll read your comment in full. We are nearly out of time. Just to wrap up then, so really important, say thank you very much for your time. I know this has been an hour and a half out of your working day, so much appreciated. We've obviously had a few of these sessions. We hope to have more for the rest of this calendar year, and then we'll be going out for formal consultation. The plan is early part of 2024, and your views are critical, both during these sessions and then in that formal consultation. We're obviously continuing working with the advisor panel. Any information that you want to share with us now or as we go forward, hopefully that's just popped up on the screen. The email, either you can email me or any of the team that you've heard speaking today, or you can email our team inbox at debtteam@maps.org.uk. So any models, any ideas, any thoughts, this is the time for you to share them with us so that we can take those forward. Really interesting conversations going around the groups. One thing that I'm never in any doubt of is how passionate people feel about getting this right, and certainly I'm hoping that you can tell that that's what we want to do too here at MAP. So we'll hopefully be able to continue working on developing our plans together. We will be sharing the recording of this and any other notes or links that we think is useful that's come out. Yeah, if you have any other questions, please get in touch. Otherwise, have a great rest of your day and speak soon. Thanks a lot, everyone.
Thanks.
Thanks a lot. Bye.